Thank you, Stuart. I'd just like to make a couple of observations that I think are key to our whole discussion on prioritizing and scaling up interventions. The first, and this is something that has come up in a lot of previous discussions, the fact that all agricultural or health system-based approaches or any other approaches need necessarily to be complementary and mutually reinforcing. And obviously the objective is that we come up with an optimal mix of several interventions. It's never going to be one intervention that ensure that immediate needs for all the nutrients are met across the entire population, but simultaneously provide for additional nutrients to those that need them at different stages in the life cycle. And so determining that optimal mix and phasing is really governed by the availability of what is proven today. We need something that policymakers need something that they can roll out today. And so we really need to work today with what is already proven and is ready for a large-scale rollout. The second point I wanted to make was that where food and nutrient intake is compromised by poverty or geographic access, strategies are obviously needed to address them immediately. And many countries have worked with social protection programs such as conditional cash transfers, and these have been shown to be very successful in many Latin American countries and other parts of the world to increase household spending on food, including nutrient-rich foods. And I think that's something that's useful for us to know. And where such programs do not exist or are insufficient to cover the gaps, obviously, like in emergency settings, food distribution programs may also be required. The third point I wanted to make was that today in many parts of the world, we all know that the diets of populations are dominated by cereals with inadequate intake of all the other value-added foods such as pulses or fruits and vegetables or animal or dairy products. And the nutrient content of cereals as they are currently grown and consumed today are definitely not able to adequately provide all the nutrients that are required. And that's one of the main reasons why we have large deficiencies in several parts of the world. And that underscores the importance immediately for either food fortification in the short run, and I hope that that will be slowly and progressively replaced by biofortification that can take care of these key nutrients through the cereals, because that's a fact of life that diets are dominated by cereal foods. And while we would love to move towards a much more diverse diet, that's not going to happen in the short term. And we also know that even with all nutrients being provided through foods in fairly reasonable quantities, the nutrient needs of the most vulnerable, specifically pregnant women and children in the critical 1,000 days of life, must be ensured through a combination of approaches that includes not only nutritious foods, but also supplements. And that's something that has to continue to the future. Even in the most industrialized countries, we have supplements being provided at that stage in the life cycle. The other point I wanted to make was that all efforts should be guided by effective advocacy and communication at all levels. And we are particularly struck by the fact that high-level political commitment, where it has come from the office of the president or the prime minister in many countries, has been key to ensure very successful nutrition outcomes. We've seen that in the last decade in countries like Brazil, Mexico, Thailand, and more recently in some of the African countries like Senegal and in Malawi, where nutrition sits in the office of the prime minister or the president. I think that makes a huge difference. And if that kind of priority can be given to nutrition in several of the countries, I think it could go a long way. And just in terms of sending a strong message to all line ministries that this is being handled from the top. Here, I'd also like to underscore the need for a better communication and cooperation across all sectors, including across agriculture and health. And even within these sectors, whether it's agriculture alone or health alone, the priority for nutrition is still not strong enough, and that's something that needs work as well. I'd also like to make a pitch for the private sector, which Kevin raised. How can we channel the capacities and the resources of the private sector and the huge potential for good in a constructive and responsible manner? And I think as a rule of thumb, I think if someone did a survey of what proportion of the population can actually pay for their own meeting their own nutrition needs, I would guess, although I have not seen any systematic study, I would guess that 60 to 70% of, or a majority of the population in any country should be able to pay for its own nutrition needs. And so my proposal is that if governments could enable the private sector to play that role and address the needs of the majority of the population, the public sector could then focus its efforts and its resources on those really at the bottom who need real support to either purchase their foods or through social protection programs. So I'd like to close by saying that achieving impact on maternal and child nutrition, both in the short and long term, will require a broad and coordinated effort, and we've heard that several times earlier in this meeting. And I would also strongly push for a Sun process type of approach that offers a comprehensive framework for global action. Thank you very much.